Mr. Melvin Yong.
Question 11, please.
Mr. Speaker, tuberculosis or TB is an airborne infectious disease. One can be infected with TB through close and prolonged exposure to a person with active TB, such as household members, co-workers, and classmates. When infected, most will develop latent TB. Persons with latent TB do not have symptoms and are not infectious. The elderly and persons who have weakened immune system, such as those with severe medical conditions, are more likely to develop active TB. About 1 in 10 healthy persons with latent TB will progress to active TB at some point during their lifetime. To control the spread of TB, the Tuberculosis Control Unit, or TBCU, adopts 4 strategies to detect, treat, and prevent transmission that is in line with World Health Organization's recommendations. And these are early detection and prompt treatment, ensuring compliance to treatment through directly observed treatment, close monitoring of treatment progress, and tracing and screening of close contacts of infectious cases to identify infected contacts early and offer those with latent TB preventive treatment. In addition, to prevent the importation of TB into Singapore, foreigners applying for work permit in Singapore are screened for active TB. To further strengthen TB management among the medical community, MOH launched the TB Clinical Practice Guidelines in 2016. These equip the medical community with better knowledge on TB diagnostic tools, treatment regimens, and public health measures for TB control. To deepen our understanding of TB transmission and develop better control strategies, TBCU is progressively implementing whole genome sequencing for TB cases. This helps to identify related TB clusters more precisely and improve our ability to prevent TB transmission. Specifically on multi-drug resistant TB, or MDR-TB, the TBCU will be implementing rapid DNA tests for drug resistance testing of all TB cases, reducing the testing duration from 8 weeks to just a few hours. By ensuring that TB patients adhere to treatment through directly observed therapy, it has been shown to reduce treatment failures and development of drug-resistant TB.
Thank the SMS for his reply. I have 2 supplementary questions. I think first, earlier this year, MOH released an update that 2 in 3 new cases reported last year in 2017 were aged 50 and above. And up to 30% of older residents in Singapore have latent TB. And from SMS earlier reply, about 10% of those with latent TB can possibly develop the active form. So my first question is, with an aging population, will the number of patients with active TB continue to increase further because with growing numbers? And if so, then are there plans to have more targeted public education, public awareness for this group of older Singaporeans to maybe get them more aware what signs to look out for, what precautions to take? That's my first question. My second question is, I think last year there was a case reported, a staff member at a preschool in Clementi was diagnosed with active TB, and then subsequent screening found that 39 children and 4 other staff members were diagnosed with latent TB. Are there any plans to screen staff, specifically working at preschool centers, to ensure better protection for our preschool children?
I'd like to thank Mr. Melvin Yong for the 2 supplementary questions. Mr. Melvin Yong is right to say that the prevalence of latent TB amongst the elderly Singaporeans are quite high, in the region of about 30%. And the reason for that is because TB was endemic in Singapore. and was very common until the 1970s. And as a result, it is not unexpected to see the prevalence of latent TB to be higher within the older age group. And however, he's also right to say that not all patients with latent TB will develop active TB eventually. 5% of those who acquired latent TB will get active TB within the first 2 years. And another 5% will develop active TB maybe within their lifetime. So based on these statistics, it is probably not necessary and not cost-effective to do screening or treatment of all patients with latent TB. And with regards to public education, yes, we have put up information on TB on our MOH websites and through press releases. And in addition to that, the Health Promotion Board also runs a special social hygiene campaign to promote good hygiene practices and also to help prevent the spread of infectious diseases. And during our annual World TB Day, TBCU also hosts exhibitions at Tan Tock Seng Hospital to educate the public on TB. So we will step up effort on public education, and we also encourage the elderly, to visit some of these exhibitions so that they are aware of the symptoms and what to look out for in case they do develop active TB. With regards to your second question on preschool, the screening of employees in preschool, under the Child Care Centres regulations, all new staff members are required to undergo a medical checkup, which includes a chest X-ray, and be certified free from active TB by a registered medical practitioner before they can start work in a preschool center. And centers are also advised to conduct daily health checks on their staff members and to monitor for persistent cough among staff members. But I must caution that sometimes it can be difficult to diagnose TB because many of us do suffer from a bout of cough in one way or another throughout our lifetime. And unless the cough becomes persistent, then these employees should be encouraged to approach the medical practitioner to screen for active TB. And once the staff are diagnosed to have active TB, of course, they will not be permitted to return to work until they have been cleared to be fit for work by the medical practitioner.